Okay, let's make a start, but there may be a few people joining as we go. So thank you so much for coming along today. I will be honest and say that I always find these things a little bit tricky to make sure that I meet the needs of the audience. In the world of face-to-face, I'd be able to tell from your faces whether this was landing right or not and ask you if it wasn't. Here, a little bit more tricky to do. So what I would really encourage you to do and like you to do as we go through, please don't wait for me to finish the slides. Please do put your questions or your comments in as we go. I'm much more interested in having the discussions that you want than necessarily getting through every single slide I've got. So hello, I'm Sarah Broadhurst. I'm the director of the Autism Education Trust. And if I can have the next slide, please, Charlotte. What I intend to do in the next 35 minutes is just give you a tiny bit of background into the AET so that you have some context, outline the strategic approach that we use around managing demand for specialist services, what it means to take a commissioning approach to embedding a mainstream plus approach. And although we're looking at that all age autism strategy, for me, the bit that I will be focusing on is around the children and young people and particularly education, as you might expect, given that we are the AET. And if we have time at the end, then we'll go through some free resources that you might find useful. If not, they're included in the slides and you can look at those later anyway. Okay, so next slide, please. The AET then, who are we? What are we? So the Autism Education Trust has been around since 2007. We're a not-for-profit partnership organisation supported by Department for Education, and you will see us named there in the implementation plan for the autism strategy. The AET delivers the only DFE endorsed training on autism for schools across England. At the heart of our partnership are autistic young people and parents and carers. We work across early years, schools and post-16 in partnership with other national organisations, but also local partners that are part of the voluntary and community sector, local authorities, and providers of early years schools, colleges as well. So we have a huge network. And if I can have the next slide. We work, because we're supported by DFE, with DFE government regions. We have a strategic partner in each of those regions that is also a licensed partner, so licensed to deliver our training. So the way that the AET works is that we have co-produced research evidence-based materials that are a combination of good practice guidance, standards and frameworks that has training layered on top, and then approaches to a strategic model layered on top of that. So we work across all of those areas when we think about culture change and embedding culture change. And because we don't just want to be a national organisation, we think culture change works best when you do it locally. We work through local partnerships, and we have a network of strategic and local partners. I have about 100 different partners across England currently, and that continues to grow. That equates to about 1,000 different practitioners and trainers out there from all of these sorts of things. So they might be local authority autism teams, school improvement teams. They might also be special schools or academies or nurseries or charities. But our network is quite vast. And to give you some context, we train about 30,000 people a year. I think in total we've trained 310,000. So it's quite a big network, but we're not as well known as we would like to be. Can I have the next slide, please? I said that at the heart of our partnership are our young autistic experts. This is a picture taken last time we were able to meet up. They are at the heart of everything that I do. Their voice is at the heart of everything I do and everything the AET does. And it has been loud and clear from them throughout the life of the AET that we talk about autism as a difference, not a deficit. So the route to changing culture and attitudes within the AET and the way that we think about this is about helping people to understand that autism is not a deficit or a broken way of being or thinking. It's actually a neurodiversity. It's a difference. We should work in a world where we embrace and value neurodiversity. And so that message is at the heart of everything we do, and it's at the heart of all of our materials and resources. They are also the ones, so all of my autistic young experts are not just passionate about autism and advocating for that message, they're also passionate about changing education and education systems, because they've all had both positive and negative experiences of education and education across the whole, so mainstream as well as specialist, as well as for some of them hospital education as well. Just a reminder, I'm sure many of you know this, but 70% of autistic young people are in mainstream education. 1 in 6 autistic young people do not feel happy at school. 1 in 5 teachers do not feel confident to support an autistic child or young person. So we have lots of work to do, and they help to make sure that we are sharing those experiences with a wider audience. So if I can have the next slide, please.
I can remember a time when people said to me, high school days are the greatest of your life, you'll see, as though it was a given that they'd be the best, leaving you feeling anything but stressed. So at 11, I moved to what felt like hell, the noise and crowds leaving me just an empty shell. High school felt like an alien land. I felt trapped in a place for which I had not planned. For 4 years, I managed to just get by. I kept telling myself I just needed to try. But by this point, I wanted to be anyone but me. I craved to be a girl able to cope and feel free. Then at 15, I fell apart, unable to cope anymore. I had to drop out of school, for that I was sure. I was misunderstood, overwhelmed and terrified. All I wanted to ever do was escape school and hide. I started to get help from therapists, doctors and more, but in my head it was too late. I had nothing left to live for. After many months of struggling to see a way out, the professionals finally listened to what my mum was on about. After assessments and tests, they realised she was right. Being diagnosed on the autistic spectrum allowed my future to look bright. For me, a diagnosis provided answers and hope. It meant I could return to school with the right support to cope. After years of struggling as a girl with autism in education, now I had my diagnosis, school supported me without hesitation. I was able to complete my GCSEs and A-levels too. Getting to this point in my life felt too good to be true. I know now, looking back, that the education system can be cruel. It's not designed for people like me to access school. It's a continuous battle and a lengthy fight to get students like me in a school that is right. But remember, there is value in looking at the wrong, because it can go on to help others to find where they too belong. So believe me when I say we will not give up this fight, that every autistic child deserves an education that is right.
Thank you. If I can have the next slide. So that poem was written by Bella. She's one of our autistic young people, and I think that sums up, unfortunately, the experience for many autistic children and young people in mainstream school settings. And why is all of this important? Because we know that when we look at the kind of transforming care data, etc., that for many of the people left in secure settings, they are autistic, but they don't have necessarily learning disabilities as well. And their route to ending up in those settings started with exclusion from school. And in many cases from mainstream settings. So the last thing in terms of the as an example of the sorts of work we do with the autistic young people, so they have worked to create these 8 promises, which for them are the things that we should be trying to achieve. They're kind of like our gold standard or our good standards. So they would like the education workforce, and wider than that, but let's start there. We promise to understand what you are good at, what you like doing, and when you might need help. We promise to listen to and act upon your ideas about how we can help you if you need it. We promise to listen to and work with the people who know you best and who you trust. We promise to make sure we are always progressing towards your goals and aspirations. We promise to make sure all staff know the best way to support you both in and out of lessons. We promise to help you to get involved and be included in the activities you wish to participate in. We promise to work together to set achievable goals that are important to you and that help you see how well you are doing. And we promise to help you to feel safe, secure, empowered, and able to learn. So that's what they want when they attend their school settings. And I'm going to go on now to talk about how we go about achieving that, both at a strategic level and at an operational level. So if I can have the next slide, please, Charlotte. So we know working strategically has impact. And for me, I really want to emphasize that. I come across a lot of initiatives that are about providing training, and we know that training on its own does not result in culture change, does not result in sustainable change that has impact. It has to be, it's part of what we should be doing, but it needs to be wider and thought about in a more culture change approach. Next slide, please. I don't need to dwell on this. We've heard, we all know this stuff, but we have lots of challenges locally and nationally, and these are the things that are keeping many commissioners awake at night, not least the fact that we do have an unsustainable increasing demand for specialist services, and we need to find ways to manage that. So if I could have the next slide, please. So how does the AET work with this? This is a managing demand model. It was actually developed by the Institute of Public Care at Oxford Brookes University, who's one of their USPs is all around commissioning. It was a model that was co-produced with all of the stakeholders that you would expect to be involved, and it was actually, when it was first done, it was an all systems approach as well. So although I'm talking about this in terms of education, because I'm talking about what we do at the AET, actually it's used across whole systems as well. So essentially what it says is that there will always be a cohort of people who have the complexity of need that requires specialist services or specialist intervention, or have parts of their well-being or their life that require that kind of specialist intervention. But we also know that there's lots of people who end up there because things have gone wrong in mainstream services. There has been crisis, etc. Their needs should have been able to have been met in mainstream services, but weren't. And out of crisis or desperation or both, people end up in specialist services, and then it's very difficult to move back out, as we have seen. In the main, we've had two key approaches to trying to prevent that. One has been around early intervention, and one has been around short-term intensive intervention. So that might be your therapeutic services or your crisis intervention. Both of those things are really important and we should continue to invest in, but on their own, they're not enough. And part of that is because they focus on individuals, as they should do. They focus on the individual and perhaps their family or their circle of support. But what it doesn't do is change the culture of the setting, the mainstream setting in the first place. And it doesn't upskill the whole workforce. So in order to do that, which is one of the things we need to do to really prevent that kind of demand on specialist services, we need a mainstream plus model. So that mainstream plus model is An example of that is the Autism Education Trust. So we don't focus on individuals or work with individuals. We focus on whole setting, culture change, workforce development. And I'm just going to show you a short video. It has Bella in it again, but also Georgia, another of our autistic young experts, explaining for them why that whole workforce development is so important when we're thinking about our more strategic approaches. So if I could have the next slide, please.
Ensuring that the entire workforce in an educational setting understands autism. All the members of staff, no matter if they're midday supervisors, teachers, teacher assistants, or even the caretaker.
Because it's no use just having teachers that are trained in autism, or just TAs, or just a select numbers of staff. You need to be able to rely on all the members within an educational workforce to be trained and educated about autism, which is actually a lot easier than you think.
Young people need support at all times of the day, no matter if it's in the classroom or outside on the playground. Having all your staff trained up can really be beneficial to the children, so when they come in from after lunch, that they've had a successful lunch and people know how to properly deal with them to prevent any further incidents happening in the afternoon.
For me, when I was in school, it was probably the teaching assistants that knew most about autism. Aside from them, teaching staff didn't really have any knowledge of it. So if there wasn't a TA with you in the classroom, or there wasn't, and you weren't with anyone from the learning support department, then it was kind of just luck if you had a teacher that understood or was aware of any difficulties you might face.
So I have seen firsthand about what support can do for a child to make sure they are properly trained in the field. If all the staff are trained, TAs can step into other roles where support is needed if someone's off sick. So they have all the teaching methods about how to best support that child in order for them to progress in their education.
Next slide, please. Okay, so that's all well and good in the sense that we know what we need to do and what we want to do. We need to engage in that kind of culture change with settings, have a mainstream plus approach, and part of that is workforce development. But what does that actually look like in practical terms? So the way that we work is kind of fourfold, really. We have standards frameworks or a standards framework for mainstream settings. We have one for early years schools and post 16. They're free on our website if you go to our website. And they give you essentially the 8 principles of good autism practice. So quite regularly, and the last one was done probably about 2 years ago, we do a big review of all of the research and evidence that is out there. We commission that out. We have an academic institute do a big scientific review of all of the research and evidence, and out of that they draw what is good autism practice, what are the principles of that. And then once we've got that, we redevelop, or in a co-productive way, all of our materials and resources. And the foundation of that is our standards framework, which sets out those good autism practice principles, but in a practical framework. So if you are a school leader or a nursery or a college, you have, I think we now have them down to 8 principles, 16 standards of things that you should be at an organizational level doing if you are embedding good autism practice. And we provide mentoring for school leaders to embed that standards framework. Then on top of that, we layer training. So we prefer to do training as whole school, whole settings. In this case, I'm talking about schools, but it could be the whole nursery or the whole college. We have kind of awareness raising training, and then we have levels of other training and topic-based training that can support specific needs. So if there is a specific issue around anxiety, for example, then we have specific training that will address that. And because all of our licensed partners are using these materials, but also have their local expertise, they are able to then bespoke our evidence-based co-produced materials, but in the way to meet local need and to focus on the things that need to be focused on and to bring in their own local experience as well. It's really important that whole setting training is done, though. As Bella and Georgia were saying, it's not enough if just one person in the school knows about autism. They might not be there when you have your meltdown. They might not be there to advocate for you when you're told you've behaved inappropriately and are about to be excluded. So whole school or whole setting training is really important. We're just launching then, so we know knowledge isn't enough. We need to help people to build skills. So we have a competency framework that is aimed at, so this is about developing your own individual practice. And we, in the autumn, will be launching our peer learning network that allows all delegates that have attended our training to work on that competency framework and come together to do that and to support each other, because as we know, knowing what to do and being able to do it is really tricky, and there's all sorts of reasons why in your setting you might struggle to implement good practice. So having peer support around that's really important. And then we have a progression framework which can be embedded in school information systems and is a way of measuring the progress of outcomes for autistic children and young people. And if a setting is, particularly if they're a school setting, is engaging in all of those things, those also make up what the National Autistic Society would be looking for if you wanted to apply for the School Inclusion Award that they are about to launch. It's based on our standards framework, and we've worked in partnership with them to develop that. So that's kind of pragmatically how we do it. If I could have the next slide, please. I said that we work around this framework of what is good autism practice, and that's come out of the research. So we have that in quite an easy, simple to use approach. So we have 4 themes. We think good autism practice is around understanding the individual, making sure that you build positive and effective relationships, not just with the individual, but within the system. That we create enabling environments, and that we engage in learning and development. And so those 4 themes are broken down into 8 principles and promises, and then the 16 standards and competencies. And that's the framework that underpins everything that we do from a resource training kind of approach. If I can go on to the next slide. So that mainstream plus model then is really about taking those 4 themes and really thinking about them then at a systems level. So what does an enabling environment actually look like? What do we mean about positive and effective relationships? How do we understand individuals that are working within that system, what their agendas are, what their priorities are? How do we find common ground? How do we align these things? And what is our joint learning and development culture? We know at an individual setting basis when we do that, that results in children and young people who get a positive education, parents and carers who experience family well-being, because if education is failing, then we know from the research that that has a massive impact on family well-being, that has a knock-on impact for all of the other services. We know that commissioners then get value for money, and we have an education workforce that feels skilled, confident and resilient. And all of these things have that ripple effect across the system. And I'm going to give you 2 case study examples now. And I'm also going to remind you, please, if you've got comments or questions, do put them in the chat. I have no way of knowing whether this is landing well with you, if this was what you were expecting to hear, or if you're wondering why you're in this workshop. So any feedback at this point would be great. And Charlotte, if I can have the next slide, please. Okay. So this first case study is from Lincolnshire then. So Lincolnshire Autism Social Communication Send Outreach Service began to embed the AET programme in 2015. During that time, so between 2015 and 2019, there was a 28.4% increase of autistic children and young people in Lincolnshire schools. Lincolnshire delivered the AET training for schools and their communities, which included parents and other professionals. They provided that mentoring support to leaders to embed the standards and competency frameworks, so the standards at an organisational level and the competency frameworks through supervisions with their staff. And they embedded the progression framework in EHCPs as a way of measuring progress and being really clear about what outcomes we were looking for. And then strategic commissioners worked to make the AET programme part of the local strategic approach that was in their strategies and policies. During that time, because Lincolnshire did a great job of collecting data before, during and post, they know that there's been a decrease in the number of exclusions of autistic children and young people from mainstream settings of 80% since 2015. And they also know that it resulted in a reduced transferring to specialist school settings between 2017 and 2019, and it was resulting in a saving of over £1 million. And just to give you some context, so their license for the AET is 15k, approximately 15k a year. So quite a saving. Next one, please. So this case study is from Leicestershire. So Leicestershire have what we call an all-phase licence. So they work across early years schools and post-16. They made training mandatory. So they were essentially the kind of outreach team that education settings would refer to when they had pupils or children or young people, autistic children and young people that they were struggling to cope with. So they were that team. And before they started with us, they were really struggling to manage their caseload. They had so many referrals. They were going back into the same settings time and time again for similar issues, just different children, and they were wondering what to do about it. So they flipped it on its head and they changed the structure of their team. They reduced the number of people who were doing that individual work and increased the number of people who were working in a kind of whole setting culture change way. They invested in our license and then they made the training mandatory. So settings couldn't refer to the team for that individual support around individual children unless they were engaging in the training. They also made sure that leaders had to engage in embedding the standards and competency frameworks, and that they embedded those frameworks to inform EHCPs and funding requests. And then slowly they started to offer that training out to other stakeholders as well. They found between 2017 and 18 that there was a 17.5% increase in the number of autistic children and young people in Leicestershire. But by implementing this Mainstream Plus approach, the team managed a 3% decrease for specialist support. So again, embedded in that strategic way with the support of their commissioners, they were able to have quite significant impact. Okay, if I could have the next slide, please. So applying a commissioning approach then, what do I mean by that? So if I can move on to the next one, I think my experience, so I've really come over from health and social care. I used to do far more work in health and social care perhaps than I did in education. And it feels to me that there's learning on all sides to be had. But one of the things that we could learn from an education perspective is some of the commissioning approaches that we do use, say in social care. So when I used to go into local authorities and support learning disability commissioners around adult service provision, one of the things that we got quite good at was mapping the market, working out the organisations that existed in that market, what their priorities were, what their language was, and what our common ground was, so that we could better influence particularly those private providers so that they started to deliver and provide what we wanted. We can do a similar thing here in education. So if I could have the next slide, please. if I take the example of Multiacademy trusts as being that private provider, what are their priorities? Well, one is that they want their schools to be rated outstanding by Ofsted. What's their language? Well, it is the language of the Ofsted framework, teacher standards, head teacher standards. So we need to be familiar with that language. And our common ground, well, Ofsted describe an outstanding school as one that delivers outstanding lessons, and Ofsted describe an outstanding lesson as one where all pupils make progress. Now, we know from the research, and we have very clear statistical research on this, that our autistic children and young people in mainstream settings are one of the cohorts that don't make progress. So if I could have the next slide. What does making progress mean then? Well, it would mean that learners were keen to contribute, that they were able to understand and communicate their contribution, and that they need information presented in a way that they can process it and have the opportunity to communicate in ways that meet their needs. So how do we translate that back into a strategic approach? Charlotte, if you could skip the next one, but go on to slide 22, please. There we go. So language for schools is about high quality teaching, and high quality teaching actually equals inclusion, because high quality teaching is about all pupils making progress. So having that narrative and identifying the autistic cohort as a cohort that a MAT could really make a difference with, that will help all of their schools to become outstanding, is a way of getting MATs hooked in to our agenda. And if I could have the next one, please. So we need to join the dots for them. We need to make sure that inclusion principles are embedded in our all age commissioning strategies and market position statements. We need to map the MATs operating in our local area, engaging with those MAT CEOs on their priorities, not ours. And then giving them an easy route to improving the progress of their autistic pupils, perhaps by offering the AET programme. I would say that I'm the director of the AET, but also there will be other local initiatives that you're engaged in that might also give them those pathways as well. And then we need to embed the AET programme and that managing demand model as a systems whole model. It struck me, I was here earlier from 1 till 2, but then I had to go and meet some of my board members. But in a lot of what the our NHS England colleagues were talking about earlier, there was a bit of a gap around where did education fit in here at a strategic level. And for me, you know, I think that's really important to make sure that when we're looking at those systems and a systems approach and a strategic approach across those ICS footprints, etc., that we are making sure education is part of that, because we know if it goes wrong in education, that ripple effect across the system and across the ages is huge. And then we need to join that golden thread. So inclusion principles are in our strategies. We have, therefore, an approach to helping our schools be outstanding. We know it ties into high quality teaching and teacher standards, and all of the AET frameworks encompass all of that in a practical way. So even if you don't have an AET partner locally, or you don't want a license, those frameworks are free on our website. They're useful because they tie into teacher standards, head teacher standards, you know, children's rights charter, Ofsted principles, all the things that will hook in the various stakeholders across the system. I am going to stop there. There is a few slides around the different resources that we have on our website. Our new website launched last week, and so hopefully it's much easier to navigate than it used to be. And you know, there's loads of resources on there that are free and might help you on your own local journeys. I know I'm close to time. Are there specific questions? I'm trying to scan the chat box now, but Charlotte, you might have picked up that there's 1 or 2 specific questions I could perhaps answer before we finish?
Hi, Sarah. Can't see any specific questions, just a lot of confirmation that it's landing really well, and completely agree with the whole school approach and training. Apart from that, I can't see any specific questions.
Okay.
If anybody has any, please do pop them in the chat. If not, we can go into your 10-minute break before you join your next workshop at 3:50.
Brilliant. And if anybody does want to follow up in any way, you can find my email address also on our website. So please do feel free to drop me a line if you want any further discussions or any further information.
Brilliant.
Thank you.
Oh, we've got Zoe has popped her hand up.
I just wondered, as there weren't any questions, if it was okay for me to put my hand up to ask you a question. Sorry, my video seemed to make me very dark for a moment there. You probably know quite a few of us have been given some funding from NHS England to do the Autism in Schools project. I just wondered if you could, because I know part of it is with an intention to be working with yourselves. The area that I cover, which is Lancashire and South Cumbria, I think all areas do have licenses with yourselves. I just wondered if you could say a little something around how you're supporting that project, if you wouldn't mind.
Yes, absolutely. We're supporting it with the best of our abilities. So we're very keen to make sure that we support both at a strategic and a local level. Essentially, because I have such a big network, even if people are approaching my local partners and my local partners are feeling a little bit like, oh, I'm not sure I've got full capacity to, because I have such a big network, it's quite easy for me to bring people together and to support and scale up if that's what people need. I think one of the things that I would make a bit of a plea for is that there's real value in the NHS England project around the co-production, particularly the co-production with parents, and that's really important, and I'm a big advocate for that. I'm also a big advocate for the voice of autistic young people and children themselves as well. I don't think that our using us or our materials, even though we're a national kind of organisation, means that those local partners don't have the flexibility to co-produce with you and work in the way that you want. What it does mean is that they have a framework to work from that's evidence-based and co-produced. And when you're trying to make sure you get value for money, I would say what you don't want to do is reinvent the wheel. So my plea is, if you've got an AET partner and you're comfortable working with them, it's a great place to start, because they've got, some really well-resourced things that you can build on and perhaps get more impact. And, if not, then at least have a look at the free frameworks. And if you want that strategic support, then, I have all sorts of things in place across the network to take as much or as little of the work that comes our way. But I think engaging in the conversations are the most important things. And I've been so grateful to Julie Bates from NHS England, who has welcomed me into the national steering group for that project, so that I'm joined up with those conversations, because obviously we are, as from a provider point of view, the only national network providing this sort of training into education settings. And we do have quite a bit of insight, so we're happy to share that as best we can. Does that answer your question, Zoe?
Yes, thank you for that. Thank you, appreciate it.
I should let you all go and get your cups of coffee and bits and pieces before you go into your next one, shouldn't I?
Yeah, everyone should have their second calendar link, but if not, I've put Marie's email in the chat. If you're struggling to find it, just drop her an email. And thank you so much, Sarah. We'll see you in the second workshop.
Brilliant. Thank you.
Thank you, Sarah.
Thank you.